Hi, we're just waiting on Dr. Ghadir and we are going to answer any of your fertility questions. We did a panel about a week ago and had hundreds of amazing questions. I know even myself, I have questions. House. So while we're loading up Dr. Ghadir, give us your questions. Hi, Dr. Ghadir.
Hi.
How are you?
Good morning here in LA, and hi to everyone around the world. How are you guys doing?
Good morning. It's nice to see people's houses. I feel like with this, well, my thing's gonna fall over, this Zoom world, we get to see a peek into people's little personalities.
Well, the problem at home is that I have to hide from 4 kids, and luckily we let them stay up really late last night, so most people are asleep. So I'm like, okay, why don't I go to the section of the house that they never go to? And I'm just praying that someone's not going to pop up in a second.
Look, I think the audience will understand. I might have a baby crawl in or scream as well, so we're all in it together.
We are. Last week I was doing an Instagram live with a colleague in London called The Editor's List, and my 3-year-old just walked right into the room and sat on my lap for about the half of the entire time. She didn't know what was going on.
You know what? I think everyone loves it when like a cute puppy or a cute baby or like whatever comes onto my screen during a Zoom. I love it.
Well, I'm really glad we had the opportunity to do this because I got really excited. After the webinar we did, it was the panel. I got inundated with questions. And I know that this topic is just on fire right now. Every single time I've done an Instagram live over the last over the last month and a half, the number of questions that continue to come through, and I don't think I've ever been as busy in my office doing telemedicine consultations with people around the world than I have right now. So it's telling me
Isn't that crazy?
It's telling me that this is a topic that's incredibly important for people. And I think having some downtime at home and understanding and thinking about your future, your family, your fertility, and what you need to do has been an important thing for people to address.
I agree. And I think the thing that you and I, well, we all discussed on the last panel, and then you and I kept discussing, is changing this mentality where you don't wait until there's a problem. You don't wait until you've been trying for years and suffered and gone through a lot before you start to think, even before you go to a fertility specialist. Women, I just think, aren't having this conversation young enough, or early enough. I almost think from puberty, like as teenagers, we should just be talking about it. So it's not a scary thing. It's not an intimidating thing, but we also know what to look out for.
I think it's very true. And it's really true. You don't want to be attacking this once things are going downhill. Once you are not doing well, you want to be in control and do things when you're doing really well. And that's why we wanted to clarify a lot of questions that we got. So Rachel, I'm going to let you go ahead and start shooting off all the questions that you got.
Absolutely. So guys, I have all of your questions, but I want to make sure you're here when we answer your specific questions. So just paste it back in so we know you're here. The first one I saw pop up in the comments so far, someone asked you to refresh on AMH levels, maybe even backtrack. What is that test and what are good numbers, I guess, at certain ages?
Okay, so absolutely. So the AMH test, which is probably the #1 most important blood test, AMH, anti-Mullerian hormone, is the hormone that comes from every little egg that people have in their body. So women are born with a fixed number of eggs, and during life and during time, as time goes on, that number just keeps going down and down and down until you hit menopause. Once you hit menopause, around the average age is about 51 in the world, you at that point have no more viable eggs or eggs. Now, what happens is that during this time period, every month when you ovulate, starting at the age of like 13, 14, when the average menstrual cycle begins, every month when you release that one egg, about 1,000 other eggs will die off in the process. As you get older and the body has to try harder, even more, it gets to be 1,100, 1,200, up to like maybe 2,000 eggs will die off during that period. And then the quality goes down too. So what we're trying to do is get a blood test that tells us what is your reserve of eggs. I generally tell people to get I think it's really smart. Every time you go to the gynecologist, ask to see what's in your AMH. If you go 1 year and you go back in a year or two to see your gynecologist and the number's going down significantly, just understand that your eggs are going down like that. If it's kind of really steady, then you know that you're kind of at a good level as well. So that's a really important thing to do. I think it should be done every year. If it were me, I'd make a law that says you get into college, you have to do it. You're graduating, you have to do it. And then you should do it once a year. And that would save a lot of people a lot of headache. It's a simple blood test. The problem is that many general doctors have no clue what it is. Mostly it's OBGYNs, some, and all fertility doctors who know what it is. But it's a simple blood test that now almost every single lab that I'm aware of can check for you.
It's so interesting. I'm 35, almost 35, and I've never heard of it, never taken it. So I definitely think it's something like a low-hanging fruit. Like, let's just
it's the lower, it's right here. You can grab onto it right now.
Exactly.
It's one of those things that we are trying to educate OBGYN doctors that see you on a regular basis to say, hey, you know what? You're in your 30s. I don't know if you have any more desire for kids, but let's get this blood test and see how you're doing. The other problem is that when many of the OBGYNs or general doctors are doing this, unfortunately, they don't know how to interpret the results that well either.
Sure.
So if one of the things we do for people, and I've done in the last couple of months, is that we do the phone consultation. Once you're an established patient of mine, I can give you a lab slip to go anywhere around the world to do this.
That's so cool.
Send me the result, and then by phone, we'll go over the result, and I can tell you exactly how you're doing.
That's incredible. So even if people are completely new to this, or even if they have a doctor they've been working with, they can get that second opinion, even if they're in Africa or Paris or wherever they are.
I had multiple people this week that were in the beginning of a cycle, since clinics are opening up here and there, just wanting to run by me what they should do. And I have to tell you, 3 out of the 4 people that called me from the other side of the United States have decided now to put what they were doing on hold there and try to figure out when to come over to our own clinic. Because I said, listen, I don't want to waste another month of a poor cycle. And this sounds like I'm not going down the right path. I'd rather wait and come to your own clinic and try to do it the best way I can and make a trip out of it. So we're happy to help in any way we can.
Amazing. Are you comfortable speaking to, I think the question specifically were like, what is a good number at a certain age? Or is that really different for everyone?
It's really different from age to age. But what I did want to say is that the AMH level, generally speaking, if it's over 1, it means you've got a decent number of eggs. Now, if you're 30 and it's 1.1, which is over 1, that's actually a really low number for a 30-year-old.
Sure.
And it means that you need to be proactive right away. If you are 41 years old and the number comes out to be 0.9 or 0.90, that's actually for a 41-year-old an excellent number.
Right.
So it really depends on where you are. It also depends on what your goal is. Are you just wanting to have 1 more kid in the next couple of months? Or are you wanting to have 4 kids starting in like 6 years from now? So those are the things that I help people understand and interpret. There's a lot involved in the interpretation of that number.
Yep. Yeah, I bet. It's not as simple as just get it and get your number. But it's a great, I think just at least sharing that basic knowledge is a great place to start.
So
I'm going to jump into the I'm going to jump into the next questions because we really want to get through as many as possible today. Someone's asked, do women with irregular periods, heavy bleeding, lose more eggs because of the heavy blood loss? Are they related?
So completely unrelated. Your uterus is where your blood loss comes from during your menstrual cycle. Your ovaries are out here. The uterus is here in the middle. So these are 2 separate organs. The ovaries are out here. The uterus is here. You need to understand and find out why you're having many heavy periods. Maybe it's caused from something else like a fibroid or a polyp that's inside the uterus. It has nothing to do. Your blood flow has nothing to do with losing eggs. People have told me, God, I know when I get a heavy period, I'm probably losing more eggs. Eggs aren't coming out of your uterus. So eggs are dying off in the ovary. They have nothing to do with each other, but that is an abnormal problem we'd want to deal with.
Okay, got it. Next question. Are eggs reserved during pregnancy? So I guess for those periods you miss, are you saving eggs each
That's
time?
a really, really good question. So during the ovulation period, eggs die off, okay? I have to say the science behind this is not perfect, but I personally think and have seen that people that have had quite a few pregnancies have usually a better egg reserve than others. So maybe because you're not ovulating, yes, you're saving eggs. Eggs die off no matter what, okay? Eggs die off no matter what. But during pregnancy, I personally believe that that process of the egg dying off slows down significantly.
Got it. It could be not the chicken or the egg, though. Could it be in the sense that maybe those people, they've had a lot of pregnancies, maybe they had a very high level to begin with as well?
Kind of. I mean, there is validity to that comment.
Okay. So next question: high prolactin levels, but not prolactinoma. You meant correct.
So let's
Why
talk
does
about
this happen?
what prolactin.
Can you actually zoom out and explain what prolactin levels are? But I don't know that, so I'm assuming a lot of people don't.
Absolutely. So prolactin is the hormone that goes up in the body when you're breastfeeding. Okay. When prolactin, and that's one of the mechanisms that while you're breastfeeding, you cannot get pregnant because your prolactin goes up. And when prolactin goes up, it keeps your hormones at a steady state. So you're not going through the monthly cycle of releasing the egg. So prolactin goes up, it keeps you from ovulating. Now, there's a couple different sources of why prolactin goes up. Prolactinemia is when your prolactin is high in your blood. A prolactinoma is when you have a little tiny tumor in your brain that produces the prolactin.
Okay.
Whatever the and sometimes taking medications like antidepressants or just nipple stimulation on its own. If you stimulated your nipple a lot today and did the prolactin test tomorrow, all these things will take your prolactin levels up. Anything that takes your prolactin level up is going to keep you from ovulating.
You said we got you with anything that raises your prolactin level is going to keep you from ovulating.
Exactly. Anything that raises your prolactin level will keep you from ovulating. And that's a really important thing to know. So there are simple medications that you take twice a week, not even daily. It's only twice a week. You pick the day, maybe Monday and Friday. You take one little pill and it brings the prolactin levels down. Now, if the cause of the prolactin is from those little micro tumors in your brain, they've done autopsies on people that have passed away when they were old. They showed like 80 to 90% of human beings that pass away already have those little tiny tumors. Usually they don't do anything. And usually if you're not trying to get pregnant or anything, people wouldn't even know that they have those. But if a healthy young woman had those once every year or 2 years, we like them to get an MRI of the brain to make sure that they're not growing. So prolactinemia or elevated prolactin is not good for pregnancy, and it's very treatable, and a reproductive endocrinologist or an infertility specialist like myself can easily treat that for you.
Okay, amazing. I think you raised another point that I'm actually curious about. Is it a myth or is it true that you can't get pregnant whilst breastfeeding?
So it's both. Okay. If you are breastfeeding very, very regularly, so like I'm talking every 3 to 4 hours on the clock, there's a very, very, very low chance because of your elevated prolactin levels that you're going to ovulate at all. But if you're breastfeeding here and there during the day, mixing it with bottle feeding, an egg can slip by and grow and ovulate and release. And that's why a lot of people get pregnant when they're ovulating.
What are they Irish twins or something? What are they called? There's like a name for it. Okay, next question. What is the next step when doctors can't identify reasons for non-conception after fibroid treatment? I have a 13-year-old.
So fibroid treatment, so for people who don't know what fibroids are growths of benign muscle balls in the uterus. So the uterus is this kind of like a triangular shape with all flesh around it. And then these muscle balls grow everywhere. If the muscle balls are growing on the outside, and there is a cancerous version of this, but 99.9% of fibroids are benign and nothing to worry about. If they're growing incredibly rapidly, you need to talk to your doctor. But fibroids on the outside of the uterus don't usually do much. Once those fibroids are on the wall of the uterus, so some part going around the uterus, God, I wish I had some model with me. But once those fibroids are growing in the wall of the uterus, they can be problematic. Once they start to stick inside the inside cavity where the baby is supposed to grow, if a pregnancy implants on a fibroid, there's not good blood flow through those muscle balls, and you can have miscarriages or a lack of implantation. If the fibroid surgery you had caused follow-up scar tissue, that damages your uterus and makes it almost very impossible to get pregnant. Okay. If the fibroid is close to the opening of the fallopian tubes when we're going outside, and it kind of blocks the fallopian tube because it's just like this ball growing and growing and just kind of blocks it, it's almost impossible to get pregnant. There are certain tests that we do. I'm licensed and I can do this test in my own office called the HSG. a hysterosalpingogram, where the dye goes up the uterus and then goes out the fallopian tube. And right then and there, with the patient awake and sitting right in front of me, I tell her how the tubes are doing. So that's a simple test, a starting point to see if scar tissue is formed, where the fibroids are, and if the fallopian tubes are open. That's called an HSG.
Okay, so to the person who asked that, maybe speak to your specialist about taking an HSG test, or find someone else.
And if you're local here
and if you're in LA,
we do them in our own office, and right then and there I give the results. If you can't do it locally, and again, if we did a consult, I could order the HSG for you anywhere in the country. The result will come back to me and we can go over them ourselves as well.
Oh, amazing. It's so incredible how much you can do remotely now.
Unbelievable. It's changed the future of medicine, and that will be one of our talks we're going to do, Rachel, one of the days, is how it's absolutely changed the future of medicine.
I bet. Okay, next question. How often should you take ovulation tests if you are trying? I think it's a really good question. That's
a really good question. So first of all, make sure you get a good ovulation kit. The 99-cent store has them. Nothing against 99-cent store, but a lot of my patients have not had success with the 99-cent store ovulation kits. So make sure you get a good one. If you have a normal cycle that's about 28 days, I usually, I forgot my water, sorry. I usually tell people to start the ovulation predictor kit sometime around day like 9 or 10, and then do it every single day. So like you can kind of watch that line get darker and darker. Ovulation kits have 2 lines. There's one line that's always on called the control line. When the second line is turning on, it's telling you that your LH surge, it's a surge of the LH hormone, is occurring 24 hours before you actually ovulate. So when we check them in the morning, sometime around day 8, 9, 10, and then they start to turn a little darker around 11, day 12, day 13, it's really bright. Then that night, I tell people it's a perfect time to have intercourse.
Okay. And are there, do you recommend most, like the tests, do you recommend, I know apps can also track that cycle. I know that, I feel like on the last panel, sorry, I can't remember if it was you or Dr. Crawford mentioned some ways, even without the test, like checking the mucus. There are other ways naturally, I guess, to check that ovulation period.
You said something really important. I have a ton of people that come and see me and they're like, I do this app all the time and it's telling me, I'm like, well, the app is telling you what the average perfect woman in the world, her cycle should be.
Wow.
That's not telling you about you at all. 0.
And we all know from the fact that we all have different periods and different cycles that we're all different.
I think less than 5% of women have a perfectly normal cycle that would follow the app.
Crazy.
So the average woman, you've got to check your own body and your biology by checking the ovulation predictor kit and checking your urine and seeing if it has the LH hormone growing. When you do that, you kind of can see if the LH hormone is going up. When the kit turns positive, usually between 12 to 24 hours later, you're ovulating. So that night and then the next 2 nights are your most fertile period. And after that, ovulation has occurred and is done and over with. It should coincide with some clear egg whitish discharge. It's the medium that the sperms will swim through. So that's a perfect timing to know that you're ovulating. So if you get a little crampy, if you get whitish or clearish discharge and your ovulation kit are turning on and you're feeling a little sore and your breasts are maybe a little tender, that is exactly ovulation.
Amazing. That's really, really helpful to know. There was a question in the last panel, which hasn't popped up here, but I actually think it relates to this and everyone should probably think about it. Somebody asked, how much sex do you have to have during that fertile period?
So I usually tell people 6 to 10 times a day. That's a joke. That's the answer that people want to hear, but it's obvious.
Maybe that's the answer that guys want to hear.
I've got to tell you something. I've never experienced, what men tell me when they are trying to conceive and the wife's like, you have to have sex now and you have to turn. That is the perfect way to make your perfectly healthy husband become completely non-functional.
Yeah,
I tell most women to please keep it from your husbands, okay? And to kind of set your signals of getting them in the mood.
They just think you're really attracted to them.
Just make them think they're the most handsome guy in the room, okay? And not to tell them. But basically once is fine, okay? If there's major sperm problem, that's an issue. But the average healthy good sperm lasts for many days. So if that night you have intercourse and you have intercourse the next night and the night after, 3 nights in a row, you're really good.
Okay, fab.
Okay, so with that being said, the American Society of Reproductive, and my wife is saying hi, and I guess that I got her attention when I said 6 to 10 times a day. But the American Society of Reproductive Medicine has done studies that have shown every day or even every other day for healthy sperm is perfectly fine. If the sperm is weak or can't swim well or doesn't have a good count, then it's not a problem for every other day.
Okay, got it. Amazing. So just relax, do it, but have fun with it. But
Relax.
don't
if anyone breaks that record for 6 to 10 times, please direct message me on my Instagram directly, and we're going to feature you as a special kind of human being.
You're going to get a whole different kind of clientele.
This is what you call a really good wife.
Oh, look, my hubby brought me a coffee too. I was like, oh,
here's the good spouses.
Okay, next question. Partner has been diagnosed with laying sperm count in all measures. What can help with this? Already had 2 ICSI cycles, no success.
Okay, I'm sorry, what was the word? Did you say what kind of sperm? Lame sperm?
Laying, L-A-Y, laying sperm. The only answer for low sperm to keep trying ICSI.
Okay, so
Could you explain us what?
Yeah, that's a lot of great
terminology.
I like live and just breathe those words all day long, but the average person doesn't. So when sperm is a very low count or does not swim well or does not look great, when we are doing IVF, which is the process of putting the egg and the sperm together in our laboratory environment in an incubator, we are able to put the sperm under a microscope, and one of my scientists that work in my lab, they're called embryologists, puts the sperm under the microscope, and when they're looking at the sperm, they have a special medium. It's kind of like honey. When you put the sperm through it, it slows the sperm so you can see which one has a perfect head, neck, and tail. You're able to kind of even slow it down so you can put the sperm into a special hollow needle.
Wow.
When we put that, the best sperm we find, so the one that looks good, the one that's moving in the right direction and not backwards or in circles, and the one that is absolutely just the absolute best one we can find. Let's say the woman has
quarterback.
Huh?
The quarterback of the
exactly. So let's say the woman has 20 eggs. Out of the millions of sperm that we find, my technologists are able to find the 20 best sperm that they can find, and then with a special needle, they put the sperm in it. And then this is the egg. They put the needle into the egg, drop off the sperm, and then we have an egg with the sperm in it. That's called intracytoplasmic sperm injection. So you take the sperm and you inject it into the center of the egg, which is called the cytoplasm. And ICSI is the nickname for it, ICSI. And that's how we get very low sperm count. Now, there are men that have 0 sperm, and our urology colleagues come in and they actually pick the best looking sperm out of the testicle with a special little procedure. We don't have to get into much more detail about that. And as that sperm is then found from the testicle, we have even gotten people pregnant where we found 3 sperm.
Wow.
Instead of like 30 or 300 million sperm, like 3, and those were the sperm we use. So if a guy has 0 sperm, we're able to have our urology colleagues come in the next room. They go and do a little tiny little resection of the sperm. It's with 1 needle. They don't even have to open people up sometimes.
That's so amazing.
And
I feel like that gives everyone a lot of hope.
Yeah, absolutely. And if for low sperm count, so for the patient who's asking, they did IVF with the intracytoplasmic sperm injection or the ICSI, I want to tell them to not give up. There's probably other aspects of the cycle that we have to discuss and I'd have to know more about, but it's definitely something that is worth discussing and seeing how you can do.
Okay, amazing. Next question. Do breast implants or can breast implants cause high prolactin?
Usually a no. No.
Okay.
So breast implants.
Myth busted. Okay, next question. I'm 31 and I was going to try to conceive my first baby this summer. Would you suggest waiting a year due to COVID? I'm hoping to have 2 to 3 kids.
So I would say to a 31-year-old who's about to try and wants to have 2 to 3 kids, the first thing you should do is check your AMH and make sure it's solid. If it's not a solid number, you may want to consider making all of your embryos for the rest of your life now before trying to conceive. And then next summer, take one of these beautiful embryos and put it back in you. And you'll know from now how many beautiful embryos you have that are genetically tested and normal. And if you want to know the gender or pick, you can as well. So that's what I would do, because I'm a very proactive person. This is my life, to help people have beautiful families.
Amazing.
If that's not an option for you, I would say, to be very honest, talk to your OBGYN and see what their rules and regulations are for getting pregnant. I think that if you are smart, you know how to quarantine, you are in a place that is not at high risk, you should consider maybe this time that have some downtime as a perfect time for potentially trying to conceive. Now, there's a lot of unknowns. If you are at potential high risk, there's people all around you getting COVID, I think I would stay away from getting pregnant right now. We do not know the overall risks and what the potential harms of COVID on a pregnancy.
Okay.
So that question is a very tricky question.
Sure. I think, but it all comes back to that, like, just start by opening the conversation with an AMH test, like, just get a bit more information rather than, you know, shooting.
It's a perfect time right now that 99% of doctors out there are offering telemedicine consultations to take advantage of getting as smart as you can and know exactly where you stand before moving.
Amazing. Okay, next question. Is fertility hereditary?
Yes and no. So there are some aspects of fertility that are hereditary, like polycystic ovary syndrome, premature menopause, endometriosis. They're not always hereditary, but yes, they can be hereditary, and those things can affect people in a negative way. The other thing is that what's not hereditary is if your mom had a baby at 20 and had like 4 kids and did well, and you're starting now at the age of 38. So I can guarantee you that your mom, if she had started at 38, was going to have some difficulties as well. And those are not hereditary. Those are normal female age-related fertility issues.
Yeah, and we forget that pretty much each generation pushes it back a couple of years with like the average age that we're starting families.
I think that my grandkids, when they start to have kids at the age of 63, 64, are going to pray that they had they had embryos frozen at a younger age.
Totally. You'll get their embryos frozen like the minute they pop out. Okay, next question. Do you believe changes in diet do make a difference in regulating hormones? For example, cutting dairy, less sugar, etc. What do you think? Also, I want to ask on that, a lot of people mention like going plant-based as well.
So, absolutely. Your diet has so much. You can't, just because you can't see your insides doesn't mean that they're doing amazing. I'm a huge believer. Listen, I have the biggest sweet tooth in the world, and I love to indulge. At the same time, when I thought I was hopeless 2 months ago and all this belly fat and love handles were going to be there with me for the rest of my life, and I just gave in. I'm like, I'm almost 50. This is what it's going to be like for the rest of my life. I'm going to look like one of those middle. I decided to, when we stopped going to restaurants, when I've really reduced how much I was drinking, I decided, because there's so many people jogging and walking in my neighborhood, I'm going to start jogging. I could jog like 4 or 5 minutes before, and now I'm able to do 2 miles nonstop. And
wow.
If I can run 2 miles nonstop, anyone can do that as well.
And you just started that like a couple of months ago.
I started 2 months ago, going for little jogs, and I was like, I wanted to make a goal from here to this school that's down the street from me, and I could barely make it halfway. And I did a little, and there was this app, I think it's called like Free Runner or something. There's different things that they have on it. One of them, it's been great. I just pushed free run and I hit it, and at 5 minutes it tells me how far I've gone and what my pace has been. So I just like, I'm dying to push myself to that 5 minutes. So when I hear like, your personal rate right now is this, and you've done this much, it's become like my goal to hear that woman's voice.
She's your coach. Like, you're a life coach to so many other people. And she's that for you.
And they have a different version of it where you can actually pay something and then it helps you get to your goal. Like, I had put a goal of doing a 5K, and I did it the first time. And then she like, you walk for 3 minutes. Now she's like, I want you to walk faster now. I want you to jog till you can't really talk to the person next to you. So it's been absolutely amazing. But eating healthy, I'm a huge believer of what you put in you is what makes your insides. So I highly recommend a healthy Mediterranean diet. If you are overweight, get rid of the sugars, get rid of the carbs. Nothing more than I like in this world is sugary desserts and also carbs. I die for them. But,
Yeah.
you know, I realize that they make me also feel awful. They taste good for the 5 seconds in my mouth. And like an hour later after I had a donut, I want to commit suicide because I feel horrible. Okay. So I just realized, like, if I'm going to have a dessert, let me have something really good. I don't know who lives in LA, but my wife in the freezer had Craig's restaurant has their ice cream.
Yeah.
And it's like this gluten-free. It just was like magical to have a couple spoons of that last night before I went to bed. But putting something healthy in your body, I think is really important. If you are overweight, take advantage of this time. I can't stress how much extra adipose tissue or fat around the body negatively helps or reduces implantation. So take advantage of trying to be healthy. Go through your house and get rid of the ice cream. People are commenting now on Craig's ice cream. Getting rid of all of the horrible things in your home. Just put them somewhere and give them to a shelter where people can have it. Get rid of the stuff that really are harmful for you. And I think being on a healthy Mediterranean-based diet with nothing with preservatives and healthy, fresh things. And I don't do a zero carb. I don't do that at all. I have a lovely piece of wheat bread in the morning, and I have pasta here and there, and I have rice here and there, but everything in moderation.
Okay, fabulous. Let's keep going through. There's so many great questions we want to get to. Okay, next question. With working from home, sitting for entire days with a laptop on the lower stomach, will that hurt your eggs? Opinion on those blankets that block the radiation? Good question.
Please do not put your laptop on your belly or on your man's stuff, okay? So, have you ever touched the bottom of a laptop?
It's kind of hot and buzzy.
Really? You think testicles love that? No. Okay. No. So for women, I don't know the data on it for men. Okay. For women, okay, because the ovaries are tucked away, but I can't imagine something that has radiation and heat being good to be on your body. Use a table. So please use a table. Use there's these pillows that have a top on them and like a table like that. Anything is better than on you. I know for a fact that studies have shown that it's very, very bad for men, and having testicles outside of the body is for a reason, to stay cooler than the rest of your body. And if you're heating them all day long, sperm quality will go down.
Okay, really good tip. I think everyone, that is like another thing that just everyone should know from their teen years.
Absolutely.
Okay, what are the chances of sperm actually meeting in eggs days later after intercourse?
Studies have shown that good sperm can last up to 5 days. And there's always people that are like, oh my God, I had sex once this month, but it was on that date and it was this much past. So there's people that have sex at weird times during the month that are far away from ovulation and get pregnant because sperm can last for a very long time. Studies showed that sperm that was sitting on a counter in a laboratory, some people's sperm lasted 5 days later, was still moving.
Not even inside a body, literally
exactly. So imagine inside the body where that environment is absolutely perfect.
Okay, good to know. Next question. I'm 36 and seem to be going into early menopause. My gynecologist sent me to a fertility endocrinologist, but I don't feel ready to go as I am not looking to get pregnant now.
So that's a really great thing to know. And to be honest, fine. Make your embryos now. Don't wait till you go into that premature menopause, and use them when you're ready. Do it on your timeline. Empower yourself, but don't close doors for your future. So if you're going through early menopause and you do not make yourself some embryo now, if you're lucky enough to still be able to do so, down the line, you may have a very, very, very hard time.
Okay, good advice. Next question. I've got AMH of a 3.5 to 4. So that sounds pretty good from what you've been saying.
Excellent.
Every IVF cycle, I only get 3 to 5 follicles and 3 fertilized eggs. Is this normal, or is there any possibility of me getting more? Or would that mean that they are low quality?
That's a really multi-answer question. So that's an excellent AMH level. most people with that AMH level in my office are making probably around 20 eggs. I think that you should try to check your AMH in a different laboratory to see if it's maybe just that lab that's completely off. I also say you correlate that to the ultrasound, because on the ultrasound, when we're looking at ovaries, there's these little bubbles. They're called antral follicles. If your antral follicle count is actually high, you have a lot of eggs in your body. If the antral follicle count is low, you don't. So if the antral follicle count for this patient is actually low, and her AMH is really high, I'd probably say the AMH is probably wrong and not accurate. If the antral follicle count is high, meaning they have anywhere between like 6 to 12 little bubbles on each ovary, and the AMH is high, there's something 100% wrong with the protocol of medications that the doctors are using on that person.
Okay, maybe get a second opinion.
And check the lab. That would be a person that I would absolutely love to look at their records and give them my honest opinion.
Okay, amazing. Contact Dr. Ghadir. All right, guys, we've got time for a couple of more questions. So bring them, keep them coming, and we'll get through them as quickly as we can. Next question. And this actually just relates to what you were talking about. So at our last panel, you recommended how some labs are better skilled at reading the AMH test. How do you find a reputable lab? This person's based in New York, but maybe you could give some general advice on how to find a reputable lab, So
I got multiple questions last time about which doctors I like in New York City. And I have some people that I know really well. There's people that I don't know, so I don't know if they're good or bad. But from the people that I know well, I have a lot of patients of mine that are bi-coastal. New York, LA is both home for them. And I've seen them do cycles of IVF. And these people, there are a couple doctors in my own age range that I absolutely love there that I know for a fact are really good. In terms of labs to go and do blood tests, most of the reputable like LabCorp or Quest do a good job. We run a lot of our labs inside our own office, and they do really, really well. And we're happy to write, if someone's an established patient of mine, I can write a lab request sheet for anyone to go anywhere in the country and do the blood work.
Okay, amazing. That's really good advice. It sounds as well like start with like a good doctor that you talked about this as well the last time. Like a doctor not only has good recommendations, but one that you gel with and trust. And then they're probably also going to help you understand that like lab territory.
And while you're looking for the last question, I did a few consults with patients in New York City, and also there was Philadelphia as well this week. And people told me, if you know someone here, can I do like my ultrasounds and blood tests and just fly in towards the end to do my egg retrieval in your lab since your lab is so good? And I said, absolutely. A lot of my colleagues around the country that I trust and I know, we do it for them, they do it for us. All you're doing in their office is a quick blood test and ultrasound. And when things look like they are ready, you can fly in. Now with COVID, we have our own different challenges, but I'm sure restrictions are going to change rather soon. And at that point, we can definitely have people come on in and do it that way and do the actual growing of the embryos in our office.
Okay, great. We've got some more great questions come through. Next up, I'm 39. Should I keep trying or try IVF? Maybe
No 39-year-old should be keep trying. No 39-year-old should be keep trying. There could be a problem. You could have a low egg reserve. You could have a lot of issues that you're not addressing now. And in a year or two, it may be impossible to treat. You need to see a fertility specialist now and get a good assessment.
All right, fantastic. This is another one in that zone. I'm 40 and went to my first infertility doctor, and she is sending me for all kinds of things, like checking my ovaries procedure at the hospital. Is that necessary because of my age and we want to get pregnant?
What age was it again?
40.
100% it's necessary. If a doctor is ordering 1 or 2 blood tests on you and not checking your ovaries and not checking your tubes and not checking everything they need to, they're probably not doing a really thorough, good job.
Okay, good. So it is a sign your doctor sounds good.
It sounds like your doctor is thorough. Good. And again, if you want us to double check all the things that doctor is doing and give you our opinion, we are happy to.
All right, amazing. Next question. Do some women only have a few follicles and eggs with IVF? Can this be manipulated with drugs, or does it just depend on the person?
It depends on the person, but the right protocol of medicine for a certain person, looking at all of their hormones, looking at all of their age and all of the factors in their case, can help us make them better egg quality, and also more eggs.
All right. So yeah, someone has a very similar question, but let's go into it a bit deeper. So someone's asking here, is there anything one can do to improve the viability or quality of eggs? Couple of IVF cycles, 12 plus eggs, half end up as blasts, but not PGS normal, age 40. Should I give up hope?
Do not give up hope, because I never tell anyone to give up hope. No one should give up hope. Okay, that's the bottom line. I think that it's really important for someone like that to get a second opinion about what's going on, exactly what it looks like on their protocol of medication. The medication protocol, the lab quality, the incubators, all of those things can be letting someone down by giving negative and bad embryos at the end if it's not done in the perfect way.
All right. All right, maybe guys, we have time for one more question if you want to send it through. In the meantime, I'll ask my own question because we chatted offline. I'm going to come and see you. So as I mentioned, I'm almost 35. I have one kid. I have shared this with my audience before, which I was actually hesitant to share because I really didn't want my story. I didn't want other people to feel shitty. But then I also think we got to talk about like the whole spectrum of stories. But basically, I guess a year and a half ago, when we decided to try, we tried one time without contraception and fell pregnant that one time. So I fell pregnant very quickly the first time, but I personally want to have 3 or 4 kids. My partner, he wants to wait, have 2, but maybe like see what happens, like wait. And as I mentioned, I'm almost 35. Aside from like, we'll come in and we'll do that AMH test, do you have any other advice for me or anyone in a similar situation? I guess also adding to that, like, I feel like a lot of friends of mine who have been actually similar, fallen pregnant very easily the first time, hasn't necessarily been the same for them the second time. They had a miscarriage.
That was exactly what I was going to start off with, okay? So just because you got pregnant the first time and everything was perfect, that happened to my wife and I. We got pregnant the first time, had a beautiful child. The second time we tried, we got pregnant the first time as well. And that ended up in a miscarriage when we were close to 10 weeks. And then we didn't get pregnant for 2 years after 6 months of artificial insemination. Wow. And eventually had to do IVF, where I have twins that are now 8 years old. And we had picked a boy and a girl. And that's what I have. And last night at 12 o'clock at night when they weren't asleep, I was praying I didn't, but I do. I just want everyone to know we have a non-refundable, non-transferable, non-returnable policy. So once we make it, it's a final sale, just FYI.
We can't just dump them on you. Like, I can't just drop them.
The return policy is very complicated, especially these days. But that is absolutely true. Just because you're lucky. And I love people that are open about the fact that they got pregnant easily. But I also think that is one really difficult thing, that people who get pregnant right away the first time are the ones with the loudest voices. You never have someone at a cocktail party being like, oh, it was a cinch. We got pregnant on cycle 8. It was the best 8 months of trying ever. Like, no one. You've never heard anyone at a cocktail party brag about getting pregnant. I actually
had never heard of anyone getting pregnant on their first go. So actually, that's kind of why I was like, I think it's worth talking about the whole spectrum of things, because if, like, say I was in a good position, I have a job, we're in a relationship, but like I actually, honestly, at the age of what I was then, 33, didn't even know that you could get, people tell you it's a lot harder. So I think it's like, it's just good to know the whole spectrum.
Consider yourself very, very, very lucky. And consider yourself very smart to have the option of wanting to make embryos for the future. What I would say to someone who's 35 years old, for sure wants more kids, but not sure when, is go see a doctor, discuss with them exactly where you are with your current fertility. And as a result of that, you can decide on, do I need to make embryos? If you do decide to take the smart route, which in my opinion is making those embryos, you can decide on your terms what to do next. Yep. Meaning, that if you want to come back in a year and put 2 in or 1 in, if you want to come back in 5 years and put an embryo in, if you want to wait till, you know, or have one, try again yourself in the next couple of years, and it happens naturally, great. And if not, you have a backup plan. And then probably these are going to kick in and be the most helpful when you've hit 40 and it truly becomes difficult for everyone. And you have these beautiful 35-year-old healthy embryos tested and are sitting there waiting for you.
Amazing. Actually, that leads on to another question, which I think is general. When it comes to freezing your eggs, as you're talking about, how does age then play a factor? Like for women who've frozen their eggs maybe in their mid-30s, early 30s, 20s, whatever, they go to, I guess, conceive or complete the process, go for IVF in their 40s. How does like your age in your 40s impact, I guess, the ability to become pregnant?
I'm gonna rephrase the question because that's a great question, and so the question that people ask all the time is, and I'm going to just answer it, that your chance of getting pregnant depends on the quality of the egg and the age you froze it at. So if you freeze eggs or embryos in your 20s, it doesn't depend on your 42-year-old uterus. Makes no difference at all.
Really?
To be very honest,
that's so interesting.
Get a 60-year-old woman pregnant by 1 month of giving her the appropriate hormones to get her uterus ready again. And her chance of conceiving will be about 80% using a healthy, beautiful embryo. It has nothing to do with the uterus.
That is
nothing to
so
do
interesting.
It has to do
I had no
completely
idea.
with the age of the egg and the quality of the embryo and the genetics of the embryo. So that's why we try to tell people, make your embryos when you are healthy and you are fine. Your uterus, as long as it doesn't grow fibroids and doesn't become disastrous, will be fine later on. Now, of course, I'm not telling anyone to come have a kid at 60. There's a million other issues that can partake and happen, unfortunately, when you get older and get pregnant. But generally speaking, you do that at a younger age and you have a great embryo quality and you can use it whenever you need to.
All right, amazing. Let's try and power through. We got a few more good questions. We actually have a current patient of yours. I love that they're asking you a question here. They have their eggs frozen with you and want to do a FET in July or August. What should I be doing now? What is an FET?
A FET is a frozen embryo transfer. Okay, that's when we have frozen embryos because all of our embryos get frozen. They get frozen for a couple of reasons. One is because the genetic testing takes about 2 weeks, so we can't leave an embryo sitting there. Second is because research has shown that when your body's hormones all come back to normal after your cycle is done, you have better implantation and a less complicated pregnancy later on by putting the embryo in later when you're more natural. So for my patient that wants to put the embryo back in June or July, I would say
July or August.
July or August. Please make sure you're taking your prenatal vitamins. Please make sure you're taking your omega-3 DHA supplements. Please make sure that if there's anything you need to do with your weight or your health to be in the best shape that you can be in, you're starting right now. So we have an amazing, amazing, amazing chance of having implantation done. And also, we need to discuss how many embryos you have. And if we need to do a practice month, the month before, called an ERA mock cycle, or if we're going to go directly into it. So I recommend that you call me 2 months before you want to start so we can go over all the plans that we need to make for you to making it a really successful frozen embryo transfer.
That's so incredible. Okay, next question. I guess I have an endometriosis from my symptoms and we are trying to conceive. After 6 months, I got pregnant but had a miscarriage at 9 weeks. Do I need to see a specialist or keep trying one more time?
So she had one miscarriage at 9 weeks?
At 9 weeks after 6 months of trying. And I'm not sure, confirmed with endometriosis. She says, I guess I have endometriosis from my symptoms.
So I would say if that person is really young, not to worry about it. Lots of people have a miscarriage and they go on. But I think there's nothing you will lose by talking to a fertility specialist to see what your extent of endometriosis is. If you have a low egg reserve, maybe you're miscarrying because you have very few eggs left. The quality is really low. And the fact that you got pregnant is good, but most of your eggs are not good. Or if you've got a lot of eggs and everything looks fine, it was just one of those things that your body is so smart and knows how to take care of a bad pregnancy. Endometriosis does reduce egg quality and does make it harder to get pregnant. It's one of those really horrible diseases that we don't have much to do to help, but IVF is the best treatment for patients with endometriosis.
Okay, fantastic. Next question. Is a frozen transfer better than fresh?
If a clinic knows what they're doing, absolutely. So if the clinic's statistics and capabilities of freezing an embryo is not very good, then no, it's awful. But if most clinics, most reputable, good clinics right now in the United States that have great success rates, all freeze the embryos first, all of them freeze the embryos and put the embryos back under a frozen embryo transfer, which is very carefully timed, allows us to do special testing, allows us to have complete control over the body.
Got it. Amazing. All right. What factors determine if a patient has a long protocol or shorter protocol, and which is better?
It really depends. It depends on what your reserve of eggs is, what your age is. There are different protocols that are better for different people. I will tell you one thing. This week, I did multiple second opinion consultations, and every single patient that I talked to, I thought was on a wrong protocol. Wow. I had 4 women that were put on their and some doctors only use one protocol for everyone, and that really bothers me. I've heard of a local doctor here that sees hundreds of patients. If you're 25, 45, 35, he has one protocol for everyone. Yeah, that makes the statistics of, I mean, it makes it really easy for your office, but that's horrible for patients. So every single cycle that we do is specifically tweaked exactly for every one of our patients. And I think that's one of the reasons we have such high success rates.
Yeah, and it sounds to me like a lot of what's happening in this space, you mentioned, for example, the ovulation apps earlier, a lot of what's happening in this whole female reproductive health space is a bit one size fits all. And I really appreciate doctors like you who are taking the time to really like get into the individual patient.
Well, fertility is so not one size fits all. It's completely the opposite spectrum of that. It is so specific for everyone. Also, everyone's needs are so different. I mean, someone wanting to have 4 kids versus someone wanting a 1 kid, someone starting at 40 versus someone starting at 30. It's a different world. So much changes in the female body over time that it's so different every single time someone wants to get going.
Amazing. Someone else, you've just popped in and asked about going into a freezing cycle. They've asked about prep in diet and supplements. We actually covered that earlier on. So this will save and you can go back and watch the beginning. Someone did ask you to repeat what you said about omega. That's just a vitamin.
So omega 3s are called DHA. If you look at my posts, it's one of the posts that has all the supplements that I recommend for people to take. And if you need a more specialized, unique kind of supplement list that's for you and your body, then we have to chat. But I have one, it's on my post there. You can easily find them there.
All right, amazing. I think that's where we'll wrap up for today.
Rachel, thank you so much. You're always.
Oh, you paused for a second. Ah.
Sorry, I didn't want to. This for the first time I'm getting calls during this, and I usually never. But you're amazing. You make time go by so fast, and you moderate this perfectly. I really appreciate everything you do to go out of your way to help women and to empower people to be the best that they can be. I love it. I absolutely love it.
Thank you so much.
And I just wait till you come in yourself and do these blood tests and we can talk about them.
Yeah, and we'll share with the audience because I'm an open book, and I honestly had never thought about doing that until our panel that we did last week. And whether or not whatever happens with me, I just want to like reduce some of the mystery and fear around that test. So I'm happy to share that with you guys all. Dr. Gina, thank you so much for being so generous with your time.
No problem. I just wanted to let you know a couple little things. Yes. This week we have some really fun Instagram lives, all having to do with fertility coming up. Dr. Crawford and I, Dr. Crawford, the amazing Dr. Crawford, who was on the panel with us, and I are doing an Instagram live answering questions. So many questions have come to her and to me. So we are on Tuesday afternoon Pacific time. I think it's around 4:30 or doing one. And on Wednesday, I'm going to be talking to a phenomenal plastic surgeon colleague of mine talking about the female body. So fun things. The 26th and the 27th of May, we have 2 great panels coming. One of them is available for free for anyone who wants to watch. It's the Southern California Reproductive Center's educational seminar. You can log on and go to that website and just register. And then the other one's going to be a panel that's coming up, and we're going to give a lot more information about that really soon. Thank you so much.
I will share all of that on my page too, in case, but you all should follow Dr. Ghadir if you don't already. And then last of all, I wanted you to just share a bit more information with the audience about how they can perhaps come to you for like a virtual consult.
Absolutely. So you can either go to the Southern California Reproductive Center's website and you can click there that you want to make a consultation, or what's been working incredibly well is if you want to DM me your name, your date of birth, your email address, and your phone number, I will cut and paste that and send it to my new patient coordinators, and someone will email you usually within 24 hours.
Amazing. Couldn't be easier.
Okay, when are you coming to see me, or when are we doing a little phone
Coming
call?
soon. Coming soon. Let's do it.
This was really fun, Rachel. I love you. Thank you so much. Everyone have a great day.
Have a great weekend. Bye, guys.
For everyone who said hello from around the world, hello back to you guys. I saw cousins, friends, brothers, everyone saying hello, and I couldn't interrupt. But thank you guys all for watching.
Okay. Bye.
Bye-bye.